morning, everyone. Dr. Brace here. It is August 2nd, Facial Plastics Friday today. I thought I'd talk a little bit more about facelifts because we had a very busy facelift week. Busy week overall. Monday was Skin Cancer Day in Guelph General Hospital and Ambulatory Care, so lots of local flap skin cancer reconstructions on the face. We had clinic on Tuesday. Wednesday had a double facelift, so a deep plane face and neck lift with an upper blepharoplasty and contouring of the submandibular glands and the submentum, followed by a endoscopic brow lift, upper blepharoplasty, deep plane face and neck lift. And then yesterday, another deep plane face and neck lift with a platysmaplasty and full face CO2, followed by an open or external approach septorhinoplasty with full face CO2. So busy. We had Dr. McKinnon with us, so lots of fun working with her and teaching. And then today we have clinic. I missed last week for Facial Plastics Friday because I was riding roller coasters at Canada's Wonderland with my family. Today, I wanted to talk about the difference between a facelift and a neck lift, and why I often tell people they're not really a candidate for a neck lift. I've drawn a quick cartoon face here to try to illustrate this, and so I wanted to just show the anatomy, so bear with me here. But from your clavicle or your collarbone, you have a muscle that travels up your neck called the platysma muscle. And this is the muscle that gives you banding in the front part of your neck. I can flex mine right here. So this is the band of my platysma muscle. As we age, this muscle droops and falls forward. So a lot of people come in complaining about their loose skin and the banding of their neck. They'll try Botox in the bands. It won't make it any better. Sometimes it makes it worse, makes things fall forward. And they come in and they're asking for a neck lift. And they say, I don't want a facelift. I just want a neck lift. I want to have this lifted up, get rid of the skin. The problem with that in many, if not most people, is that the platysma muscle that causes this banding is not in isolation. It's actually part of a bigger structure. So as the platysma muscle comes up over the jawline here, it starts to peter out in terms of muscle fibers, and it becomes the SMAS. And so the SMAS comes forward and up, and this is a layer of tough fibrous tissue. It has fat pads in it that frame the eye. The malar fat pad that as we age goes down and in and creates a nasolabial fold. Fat pad comes down and creates the marionette line and the jowl. So this whole structure comes down with the SMAS, which is continuous with the platysma, which has also come down and given you the bands. The SMAS is kind of funny because then it becomes the orbicularis oculi, the muscle around your eyes that lets you squint, this round muscle. And it becomes the temporoparietal fascia, which is, again, no muscle but fascia in the forehead. And then it becomes your frontalis muscle, the one that lets you lift your eyebrows in the forehead. And so this is one anatomical structural unit embryologically, meaning that if you pull on one part of it, you're kind of pulling on every part of it. So we use this in surgery as a landmark for planes. We get underneath the platysma, we get underneath the SMAS. In a deep plane facelift, we release it. And the problem with people that say, I just want a neck lift, is that most people are also experiencing descent of their SMAS. And so this has fallen forward. They have a deep nasolabial fold. They have hollowing under their eye because the malar fat pad has come down. They have a double convexity. The fat in the eye is sticking out. There's a hollow for a nasojugal groove or a tear trough and an orbital malar crease here. More weight, more volume of their faces down here, so they look heavier down here. They've lost that heart shape of the youth. They have the jowl, they have the neck skin. And if you just take the platysma and pull the platysma up, what you end up doing is creating an imbalance. And now you've got all this tissue hanging low, and you pulled this up nice and tight, but this is low, and you create kind of a hound dog look. Now you've got jowls, and you have descent of your midface and a really tight neck, and it doesn't look right. It looks strange. And your neck may look fantastic, but there is a disconnect. One of the metaphors I like to use is think of a window treatment. Think of having a window in your house, and you put drapes on your window, big long drapes that kind of hang from the top and come all the way down to the floor. If your drapes started to pull from up here and we're starting to sag and this was starting to rumble on the floor, asking for a neck lift in this situation is like asking a seamstress to just cut the drape off at the bottom to make it look level with the floor again. When really the problem is that it's descended or fallen from the top. and you need to lift it back up to reset it so that the drape looks normal again. You don't need to just deal with the bottom, you need to deal with the whole thing. And so in a deep plane face and neck lift, what I'm doing is coming in and undermining and releasing this whole thing, and the whole thing gets lifted back up. And this is the kind of facelift that once you release it, you don't have to stretch things. So people don't look windswept or pulled because it's been released, and we're just repositioning that structure. The neck gets better, the jawline gets better, the nasolabial fold and marionette line gets better, even the lower eyelid gets better. And sometimes we can even get a bit of brow lift, depending on how high the incision goes, to make even the temple and the brow look better. And so a candidate for an isolated neck lift, in most cases in my practice, is a younger person, probably younger than 40, who has fullness under their neck, who has excessive fat, muscle, or gland that can be contoured with maybe a little bit of redundant platysma, like very early changes that could be tucked up from behind, but their midface hasn't fallen. In that situation, a neck lift makes sense. But if you're dealing with kind of full facial aging, the analogy of just chopping the drape off at the bottom is kind of what you're doing with just an isolated neck lift. You're still going to have a problem up at top, and people are going to say, why does that not match? Who installed your drapes? They're not right up top, although they're flush with the floor. So I hope that helps. The difference between an isolated neck lift and a deep plane facelift. Everybody have a great long weekend, and we'll see you next week.